The hidden epidemic. Why Lyme disease is so often misdiagnosed. Hello, I am Dr. K. Paul Stoller with a subject that is near and dear to my heart because I was once infected with the Lyme bacteria, and I have recently created a webinar on correctly treating Lyme at KENNETHSTOLLERM.com. Now, today millions of people are infected and millions are told you don't have Lyme disease. This is a disease that has infected 20% of the population, but most will never know they are infected. What if the test was never designed to find what they actually have? Lyme disease is one of the most misunderstood and misdiagnosed conditions in modern medicine. 2 decades ago, on a trip to the CDC, I was privately told whenever the government has played a role in creating a problem, they will always obfuscate. Our diagnostic framework is incomplete by design, I am afraid. I personally know some of those who have actually died from this infection, but because it was one of the original gain-of-function man-made diseases, the government covered it up. What many patients actually have isn't missed Lyme. It's missed borreliosis. First and foremost, the standard lab tests for Lyme leave out the 2 most sensitive indicators for the Burgdorferi group of organisms. It is sad but true, conventional Lyme testing focuses on a single species, Borrelia burgdorferi. But Borrelia is not one organism, it's a family. There is an entire group called the relapsing fever Borrelia that is largely ignored in standard testing. Different species, different immune signatures, different clinical patterns, yet many tests act as if they don't exist. Imagine conducting a census, but only counting females, then announcing the population is half what we expected. That's essentially what happens when we test for Lyme disease while ignoring half the Borrelia family. The conclusion isn't that people aren't infected, it's that we didn't count correctly. Patients are told, your test is negative, it's anxiety, it's fibromyalgia, it's all in your head. Meanwhile, symptoms persist or worsen. Fatigue, pain, neurologic symptoms, cognitive dysfunction. Many of these patients don't have Lyme disease as narrowly defined. They have borreliosis that was never properly identified. This diagnosis happens because testing is species limited. Relapsing fever Borrelia are underrecognized. Clinical presentation is dismissed when labs are incomplete. Physicians are trained to rule out, not rule in. The system isn't designed for complexity, but infection doesn't follow simple rules. When we broaden the lens from Lyme disease to borreliosis, suddenly, many unexplained cases begin to make sense. The question changes from, why is nothing wrong, to, what weren't we looking for? In my Lyme webinar, we'll explore how to identify and address overlooked forms of borreliosis, including relapsing fever Borrelia, and what this means for diagnosis, treatment, and recovery. Real treatment that actually gets the job done. If you've been told you don't have Lyme, but your body tells a different story, it may be time to ask better questions. Join me and take control of your health. My webinar can be found at KENNETHSTOLLERM.com. Hope to see you there.